It is Tuesday morning. Rahim, 62, former senior port engineer, Bedok. He is sitting at his kitchen table with a CPF printout in his hand. MediSave balance, 71,800 Singapore dollars. He retired 2 years ago. 5-room HDB, fully paid. Integrated Shield plan since 28. He did everything right. 3 weeks ago, the doctor used the word cancer. Stage 3. Colorectal. Rahim is staring at $71,800, and he already knows it may not be enough. Not for the treatment. For everything that comes after treatment. For the decade of follow-up. The drugs that do not appear on any approved list. The day he can no longer walk to the bathroom alone. Today we build the honest number. What illness actually costs after 60 in Singapore? Where MediSave disappears before a single diagnosis arrives. And what Rahim needed 3 years ago, when there was still time to build it. Start with what almost nobody calculates until it is too late. The MediSave cap in 2026 is 79,000 Singapore dollars. That is the basic healthcare sum, the maximum balance you can hold. It earns 4% per year. When you turn 65, your cap is fixed for life at whatever the BHS was in that year. Most people see 79,000 and think, that is serious money. Here is what happens to it before any diagnosis arrives. Every year after 60, MediSave is automatically debited for insurance premiums. Not treatment, not hospitalisation, the cost of staying covered. MediShield Life, the mandatory base insurance. At 60, around 1,400 Singapore dollars per year from MediSave. At 65, around 1,700. At 70, around 2,000. At 74, around 3,800. Pioneer Generation receives 40 to 60% off. Merdeka Generation receives 25% plus $200 deposited back into MediSave annually. Everyone else pays the full rate. Then, the Integrated Shield Plan. The MediSave component is capped at $600 per year for ages 41 to 70, $900 above 71. The actual premium for a Class A plan at 60 runs $2,300 to $3,700 per year. Everything above the cap is paid in cash, every year, without exception. CareShield Life, the mandatory disability insurance. Around $206 to $253 per year from MediSave until age 67. Total leaving MediSave annually on premiums alone before a single hospital visit, 2,000 to 3,500 Singapore dollars. Over 20 years, 60 to 80, 45,000 to 60,000 Singapore dollars, from 79,000. What remains for actual illness, 19,000 to 34,000 Singapore dollars. Rahim does the arithmetic on the back of the CPF printout. He stares at the number for a long time. That is the first calculation most people have never made. Now the illness itself. Cancer is the #1 cause of death in Singapore. 26.4% of all deaths. 44 people diagnosed every day. 16 die every day. Rahim chose the public hospital, subsidized ward. The right decision. Here is what that decision looks like in dollars. Surgery runs through the table of surgical procedures. MediSave covers a set limit depending on complexity. MediShield Life adds a payout after a deductible of $2,000 and co-insurance of 10% on the first $5,000 of the claimable amount, 5% above that. Scans, specialist consultations, follow-up blood work, billed separately, running parallel, every month. Then comes the number that changes everything. The cancer drug list. The CDL is MOH's approved registry of cancer drugs covered under MediShield Life and MediSave. If his oncologist prescribes a drug on the list, insurance helps pay. If the drug is not on the list, MediShield Life does not cover it. Some ISP riders offer partial coverage for non-CDL drugs. Most do not. And it is precisely the newest, most effective drugs, the ones his oncologist wants to use, that are most likely to sit outside the list. Immunotherapy. One dose, 9,000 Singapore dollars. Every 2 to 3 weeks, 1 year of a single immunotherapy drug, over 200,000 Singapore dollars. Late-stage cancer treatment in Singapore across all types runs 100,000 to 200,000 per year. That is 8,400 to 16,700 a month. According to Sing Life claims data from May 2023 to October 2024, lung cancer treated at a private hospital over 18 months cost close to 2.5 years of a median Singapore household's total combined income. Rahim is in a subsidized public ward. His out-of-pocket in year 1, with a good ISP, still runs into tens of thousands. Deductible, coinsurance, non-CDL components, specialists not fully covered, scans billed separately. Over 5 years of treatment and monitoring, his MediSave balance reaches 0, even with the ISP, even doing everything right. After that, insurance premiums in cash, additional out-of-pocket in cash. Every dollar from savings he built over 30 years of work. Not because he made mistakes, because this is what it costs. Change the diagnosis. Heart disease. Nearly 30% of deaths. Coronary artery bypass surgery. Median bill in a subsidized Class C ward at a public hospital, 6,966 Singapore dollars after government subsidies. Median bill at a private hospital, 75,398. 25% of patients pay above 88,942. MediSave limit for bypass surgery, up to 25,000 depending on complexity. MediShield Life adds around 7,300. A patient without an ISP who chose a Class A or B1 ward faces out-of-pocket costs of at least 36,978. Even with a good ISP, deductible 3,500, coinsurance 5%, annual cap 6,000. Those are your numbers before the surgery begins. The gap between what MediSave covers and what a serious cardiac event costs is not a rounding error. It is a second mortgage. Now the one nobody talks about at dinner. Farhan is 58, secondary school teacher, Ang Mo Kio. Hypertension since 45. Type 2 diabetes since 52. 4 medications daily. Nothing dramatic, nothing acute, just the slow, permanent cost of getting older with chronic disease. He uses the Chronic Disease Management Program, CDMP. The limit in 2026, 700 Singapore dollars per year from MediSave for standard cases, 1,000 for complex. 4 specialist visits per year at a subsidized outpatient clinic, $800 to $1,200 total. MediSave covers 700. The rest is cash. Dental. MediSave works only for surgical procedures. Fillings, dentures, routine cleaning, out of pocket entirely. 1 implant, 3,700 Singapore dollars. MediSave covers at most 1,250. The rest, cash. Glasses, not covered. Hearing aids, 1,500 to 4,000 per unit, not covered. Flexi MediSave after 65, 400 Singapore dollars per year at approved GP clinics. $400 against the real annual cost of managing 2 chronic conditions, aging joints, and everything that MediSave was never designed to touch. Farhan writes down his honest monthly medical number. He has never done this before. The number surprises him. It should not have. Here is the part most retirement plans do not include. 1 in 2 healthy Singaporeans aged 65 will experience severe disability at some point in their lifetime. Official MOH and CPF Board statistic. Not a projection, not a worst case. 3 in 10 will live with severe disability for 10 years or longer. Severe disability. Unable to perform at least 3 of 6 daily activities. Feeding, dressing, toileting, washing, walking, transferring from bed to chair. CareShield Life pays 689 Singapore dollars per month when this threshold is reached, for life. From 2026, the annual growth rate doubles from 2 to 4%. A claim made in 2030 pays $806 per month. The average monthly cost of long-term care in Singapore, 2,952 Singapore dollars. That is the 2024 SingLife figure, 27% higher than 2018. 37% of Singaporeans initially guessed the number at under 2,000. The gap CareShield Life does not cover, 2,263 Singapore dollars, every single month. Nursing home in 2026, 3,900 to 5,000 Singapore dollars per month. Private single room, 4,000 to 6,500. Government subsidies from July 2026, up to 75% for Singapore citizens, up to 80% for those born in 1969 or earlier. Means tested. At middle income levels, the subsidy shrinks. At higher income levels, it disappears. Critical. MediSave cannot pay nursing home monthly fees. Long-term care is not acute hospitalisation. Those fees come from pension, from savings, from a dividend portfolio, from family, not from MediSave. Ling is 68, Tampines, widow. 3 years ago, she had a stroke. The doctors called it mild. She has not come back to her old life. The stroke took partial mobility in her left hand, not completely, enough. She cannot qualify for CareShield Life because she cannot fail 3 of 6 daily activities. She fails 1. Officially, she is healthy. Physiotherapy twice a week at a private center, 180 Singapore dollars per session. 8 sessions a month, 1,440. MediSave does not cover outpatient physiotherapy. Public rehabilitation waiting time, 3 to 4 months. She pays from savings, every month, 36 months. Her ISP rider, she dropped it last year, too expensive at 68. 3 months ago, she was admitted with pneumonia, 5 days. Deductible, 2,000. Co-insurance, a few hundred more. Cash. MediSave at 65, 67,000 Singapore dollars. MediSave today, 23,000. She made no mistakes. She just got sick, twice, in a system where MediSave covers acute events, insurance covers large bills, and neither was built for the quiet, grinding cost of not quite recovering. 23,000, and premiums still leaving automatically every year, now a number that changes the entire horizon. Rahim is still in his hospital room. He picks up his phone and looks up something he should have looked up at 55. SingStat, June 2026. A Singaporean age 65 can expect to live another 21.6 years to age 86.6. Men to 84.9. Women to 88.1. Healthy life expectancy, 73.6 years. WHO data. The gap between total and healthy life expectancy, nearly 10 years. 10 years of chronic conditions, reduced mobility, regular specialists, medications that never stop. Nature Aging, July 2025. A simulation study tracking Singaporean older adults from 2020 to 2050. Projected lifetime hospitalization costs for people aged 51 and above in 2022, US dollar values. 75,700 for Chinese Singaporeans, 93,900 for Indians, 70,000 for Malays. In Singapore dollars, approximately 100,000 to 130,000. Hospitalization only, not outpatient, not premiums, not rehabilitation, not dental, not long-term care. People with functional disability spend 24,400 US dollars more on hospitalization over their lifetime than those without. The Journal of Public Health Policy, August 2025, said it directly. Early projections revealed that a majority of older Singaporeans lacked sufficient MediSave savings to meet the costs of later life, particularly long-term care. Rahim sets the phone down. He understands now what the number means. $79,000. $45,000 to $60,000 in premiums over 20 years. 1 serious oncology year. 1.5 years in a nursing home without subsidies. Not 5 events, not 10 years. 1. Rahim spends the rest of the afternoon building the system that should have existed before the diagnosis. Layer 1, MediShield Life. Annual claim limit 200,000 Singapore dollars from April 2025. No lifetime cap. Covers Class B, 2, and C wards at public hospitals. Deductible from $2,000. Coinsurance 5 to 10%. It does not cover private hospitals at full value without an ISP. It does not cover most outpatient treatment. It is the floor, not the ceiling. Layer 2, Integrated Shield Plan. The ISP that protects at 70 is the one bought at 35 and kept. From April 2026, new riders no longer cover the deductible. That is, a personal cost of $1,500 to $3,500 per admission, paid in cash. Rider premiums are always cash only. MediSave cannot touch them. Farhan knows this now. He is reviewing his policy tonight. Layer 3, CareShield Life Supplement. The base payout of $689 does not cover a nursing home bed. Private supplements from Sing Life, Great Eastern, and AIA add up to $5,000 per month on top. A separate policy. Worth modeling before 60. Premiums are significantly lower at 50 than at 65. Ling did not have one. She is looking at it now. Layer 4. A medical cash reserve outside CPF. Singapore savings bonds in July 2026, 2.11% average yield over 10 years, government guaranteed, redeemable any month without penalty. Not for surgery, for what MediSave cannot reach. Physiotherapy, dental, hearing aids, home nursing. The months between hospital admissions, when the body is recovering and the bills keep arriving. Farhan is opening his SSB account this week. Layer 5 is MediFund, the government endowment of last resort for those who cannot pay after all subsidies. MediShield Life, MediSave, and cash are gone. In financial year 2021, $161 million dispersed over 1.2 million applications. It exists because the other 4 layers sometimes run out. Rahim puts down the pen. 3 years ago, he had the time and the balance to build layers 3 and 4 properly. He had the MediSave. He had the income. He had the health to qualify for better terms on a CareShield supplement. He had 2 questions he never asked. Where's the medical cash reserve? The money outside CPF, outside withdrawal limits, accessible without a hospital admission. And when did he last check exactly what his ISP covers in oncology? Which drugs in his protocol are on the cancer drug list, and which are not? Those are not questions for the person sitting in a hospital bed on a Tuesday morning. They are questions for 55, for 58, for 60. Open your CPF statement now. Find your MediSave balance. Then calculate how much leaves it every year in premiums alone. What remains is your real buffer, not the number on the page. For most Singaporeans, that number is smaller than they have ever written down. Farhan wrote it down for the first time tonight. So did Ling. What is yours? Put your honest monthly medical cost, premiums, prescriptions, specialists, everything MediSave does not reach, in the comments. I will reply to everyone with a specific gap and what closes it. And if you want to see how Singapore SREITs and SSBs can fund the medical gap that CPF cannot cover, that is the next video. Subscribe so you do not miss it.